Give it a couple seconds. It's loading right now.
We are live.
And we are live.
Welcome, everyone. Welcome to this live virtual panel on the LGBTQ communities and COVID-19 vaccines. We are so excited to bring this to you. We have worked really hard to make sure that we address many of the concerns that we have received here at the Commission, and we are excited to be here with you. I am Manny Santiago. I use any pronouns, and I'm the director of the LGBTQ Commission for the state of Washington. Today we have a wonderful panel that I'm going to be introducing in a second, but as we gather tonight or this afternoon or early evening for this panel, I wanted to recognize that we are on Indigenous lands, and if you allow me, I would like to do a land acknowledgement on behalf of the Commission and the 15 commissioners that make up these commission. So the Washington State LGBTQ Commission recognizes that we live and work in stolen lands. These lands, waters, mountains, skies, and everything within them have been inhabited since time immemorial by descendants of the 29 federally recognized tribes, as well as the many non-recognized tribal communities in the state of Washington. The members of this panel tonight occupy lands that belong to the Puyallup, Duwamish, Muckleshoot, Nisqually, Squaxin Island, and Chehalis peoples, among others. We recognize the history of colonization, genocide, subjugation, and enslavement experienced by Indigenous peoples both in these lands and throughout the continent. It is our commitment as a state agency to recognize tribal sovereignty, to work alongside tribal partners for the well-being of our communities, to celebrate the achievements of the many Indigenous communities around us, and to dismantle the ongoing legacies of settled colonialism and the exclusions and erasures of many Indigenous peoples that continues today. And maybe so. As I said, I'm Manny Santiago, and part of the staff, or actually the whole team of the commission is here. We have Omar Santana, who is our executive assistant, Brandon Hancock, who is our intern, and Katie Cullis, who is also one of our interns, student interns, and they are going to be attending some of the questions that come through the chat. So feel free to put on the chat and the comments whatever question that you may have that had not been addressed tonight. Because Brandon, Omar, and Katie will be paying attention to those. They're also going to be working on the technical issues here. So hopefully we will not have any issues, but just in case. So thank you so much to all three of you for your work and your cooperation with us tonight. We don't have anyone here besides the panelists, so we don't have to worry about being hijacked or anything like that. So it is a safe space. We also want to acknowledge that tonight we are not going to be providing ASL interpretation. Unfortunately, we were not able to find an interpreter for tonight. However, we are going to be adding closed caption to this video once that is saved, and that closed captioned version is going to be available later this month for all of you to be able to access it, and for people who need some more support to access this information, to have that available for them as well. So with that, friends, I want to introduce the excellent panel that we have tonight. Dr. Chu, do you want to introduce yourself?
Hi there, I'm V. Chu, and it's spelled V-Y, but it's pronounced V like the letter. And I'm an internal medicine physician here in Seattle. I was one of the founders of Capitol Hill Medical, which is a primary care clinic focused primarily on the needs of the LGBTQ community of the greater Seattle area and beyond.
Thank you. Our next panelist, Pasha.
Hi, everyone. My name is Pasha. I use she and they pronouns, and I'm a community outreach consultant with the Washington State Department of Health, and I'm really excited to be here today.
Our next panelist, my friend David.
Hi, I'm David Hirschberg. I'm an immunologist and have been doing work in virology and infectious disease and pandemic preparedness for about 25 years. I am the founder of RAIN. It's a biotech incubator here in Tacoma, and we're focused on developing talent and also community. And we've been spending the last 9 months doing a lot of work in the community, COVID related.
Thank you, David. Our next panelist, Jennifer. Jen?
Hi, Ms. Yen Baines. I am also on the same team as Pasha at the Department of Health. We are the Community Relations and Equity team, and I am an equity and social justice consultant there, focusing on disability justice. I'm also a queer mom. Thank you.
Thank you, Jen. And finally, we have, excuse me, Diana.
Hi, good evening. My name is Diana Veronica Krishna, and I'm a COVID-19 response coordinator with Utopia Washington. Utopia Washington is a trans-led organization that serves gender diverse folks here in Washington State. With COVID-19 work, our work expanded to all genders, all colors, and people from all walks of life in Washington State. Thank you very much, and I'm very happy to be here.
Thank you, Diana, and thank you everybody on the panel for making time to share with us tonight. We already have an hour and we have many questions, many concerns that the community has brought to us and to our attention. So we want to make sure that we address as many of those as possible. And of course, you know, everything has a beginning. The pandemic and COVID didn't come out of nowhere. It has an origin. It is part of a family of viruses. We want to understand a little bit more about that. So my first question is for you, David. We want to know, you know, what are coronaviruses? How long have we known about them? What are they in general? What are we talking about when we talk about COVID and other coronaviruses?
Okay, so it's funny because now we kind of know a lot about coronaviruses, but they have been around for a while. The family, there's about 7 coronaviruses that have moved from animals into people before. And we have, you've heard of a number of outbreaks. Some of you might remember SARS. The very first SARS that we heard about was about the turn of the century in 2002. There was MERS, which is the Middle Eastern variant. And of course, this is SARS-2, but we have coronaviruses that make up our kind of winter flu season. And there's a number of circulating ones that we have. So they are known to us. There are, and then there is, we knew that there was a possibility of always an emerging threat that they were going to new strains would jump from animals into people. Nothing special. They're relatively small viruses, RNA viruses that are in a capsid. They are kind of unique in their family, but they obviously have a predilection for certain receptors that are in our lungs, kidneys, and intestines. And of course, you've seen even kind of how fast they can spread and how, depending on how infectious they are, they can move quite quickly.
Thank you, David. I have another question with that, right? Like, so we know that coronaviruses have been around for a while. We know about them. A lot of people have been questioning, you know, how quick we came up with a vaccine for this particular virus. Can you tell us a little bit about how scientists develop vaccines for viruses in general? And, you know, is it true to some extent that this vaccine came out of nowhere, that was developed like yesterday? Can you tell us a little bit about that development? And I know that this is a long process,
yeah.
And we only have, you know, a minute and a half.
I'll be brief. So I've worked with nucleic acid vaccines, like DNA and RNA vaccines, for almost 30 years. So they are not new. We've been working with them for a while. RNA vaccines were originally made and then abandoned because we thought they would have too big an immune response. But they are well known. We've actually had good ones for up to 10 years. We've just been waiting for an opportunity to thoroughly test them. And of course, now this pandemic came along. So while it does seem that they evolve very quickly, remember we had a lot of people volunteer to test these. And so literally hundreds of thousands of people tested these viruses. So we went through the same protocols that we did, but because we were able to test them on so many people, and the outcomes, the challenge essentially of the virus could happen so immediately, we were able to get data on them that really showed their safety relatively quickly.
Mm-hmm. Thank you. Dr. Chu, you work with viruses and vaccines all the time. So was it a surprise to you that there was a vaccine available this early in the pandemic, or is this something that you see frequently as a physician? Is this something normal from your perspective?
I think this is highly, I mean, this has never been seen before. This is kind of like landing someone on the moon. Getting from the identification of a pathogen to vaccine is in 1 year like this. It's just unheard of. It's never happened in our history. And I think it was a confluence of having the entire world focused, the smartest people throwing all the money they could, testing vaccines for this purpose. And it really just came together. And I can't believe it happened in a year. Normally the vaccine development is like 4 to 5 years. So this is highly unusual and really exciting. Mm-hmm. I want to add earlier about, about the vaccines being developed quickly. I mean, we have very, very good people looking at the data here. If you want to, the AstraZeneca vaccine right now is sort of being called into question because of some of the data being old. I mean, that should be a demonstration of how closely they are looking at each and every one of the studies.
Thank you. And I want to hear from Pasha or Yan. I know that the Department of Health had something to do with, with the vaccine authorization. We had a compact of agreement with other states to prove this vaccine and whatnot. Can you tell us very quickly how that process went and why we can, in Washington, be certain that the process that was followed to certify this vaccine, right, to try this vaccine is something that we can trust here in Washington, and a little bit of the process on how that happened.
Yeah, I can speak very briefly to that. So we work very closely with federal agencies and our leadership team, of which I am not a part. It involves our governor and other elected officials, et cetera. They work very, very closely with the CDC, with the FDA, and with the administration to align our plans. I can talk more about our distribution phases and things like that. And in terms of a vaccine being safe, here in Washington, we definitely go through and study all the protocols that are being handed down from federal agencies.
Thank you. So the vaccines have been developed because of the work of many people, the resources that we were able to put into these. I think that is very important to clarify, right? That and I would like for any of you actually to say a word about this, because one of the things that we have heard from our communities, we know that historically the LGBTQ community, especially certain segments of our community, have been watching the development of HIV and that particular virus, and how we have worked really hard to try to find a vaccine for that virus, and with 40 years of development, still nothing comes. But there's a difference between viruses. Not every virus is the same, right? And that's something that people don't necessarily understand because we are not scientists. I am certainly not a scientist. So can the professionals here tell us a little bit about why no virus is the same, and why some viruses are easier to target with a vaccine while others are not? Either Dr. Chu or David, from your perspective. And it doesn't have to be, every single thing, but just a reassurance of how different things and different viruses developed and attacked the human body.
Wow. Okay, let me try to I'll try a little bit. I mean, so AIDS, you know, the retrovirus that causes AIDS is really a challenge because it really is hitting the immune system. It's knocking out T cells, and so this is strategically, you know, you're hitting one of your main players in the immune system. And by the way, T cells are incredibly important in going after COVID. So I think that's the main challenge, and you know, there has been I mean, basically where we are today and how fast we could come with this vaccine is really because of the amount of work we've been doing on diseases like AIDS. We know a lot more about the immune system than we did 30, 40 years ago. And there still is a lot of promise for vaccines that would be effective against AIDS. This class of RNA vaccines is really game changing, and how fast we can be able to respond to a particular pathogen. So it's not just for viruses, it's going to be against hopefully protozoans, some like big diseases like malaria and dengue, which is another RNA viral disease. These are strategies that we can go after, but it's fundamentally, you know, we lump things as viruses, but they are basically materials that come into our body and reprogram cells to do different things. And so, you know, so COVID is a very different, you know, it's night and day compared to HIV. I hope that was a good stab at the answer here.
Thank you, David. I think that is important for our community to hear, right, from scientists, especially from someone that works with viruses every day, to hear, you know, that there are different types of viruses that attack our bodies in different ways. So the strategy to combat that is going to be very different. It has nothing to do with the individuals that get affected with it. It has to do with how much we can do with a particular, you know, living thing such as virus. So please keep that in mind for the community, right? Like the community sometimes feels that that we have not put enough research efforts or resources on the development of HIV vaccines, which to some extent is true. I'm not gonna say that it's not true. There's some of that. And at the same time, there are strategies and techniques and understanding of this particular virus of COVID that is very different than HIV and other viruses that don't have currently any vaccine, because it's not the only one that doesn't have a vaccine yet. But it's good to hear also that, you know, this new research has opened the doors for more research on other viruses that have been difficult to tackle. So thank you for that. Dr. Chu, you are a physician who provides care to our community, to our LGBTQ community. What can you tell us about the importance of getting the COVID vaccine for our community, especially with people who have compromised systems and a multitude of health challenges?
Sure. Well, I think it's hugely important for every last member of our community to get vaccinated, primarily because the vaccine is safe and it's effective. And the sooner we all get vaccinated, the sooner life returns to normal. But it's particularly important, you're right, for certain members in our community to get vaccinated. As a gay physician, I think it's important for me to encourage vaccination because historically in our community, there has been a lot of mistrust earned by the medical community. Our trans patients in particular have only begun to see some changes in our healthcare system that even acknowledges their existence. I mean, haven't we all seen intake forms that list M and F and no other options, and that's it? And they've had a much harder time finding providers that are willing to start affirming hormone therapy. They've faced ridicule by providers, misgendering by callous workers. It's dehumanizing and it destroys trust. So they are less likely to seek out medical care and thus vaccination. So we have to do a better job of reaching out. People of color have had to face down very similar discrimination in healthcare, and they've also faced arguably worse. There are many examples, but probably the most egregious example is the Tuskegee Study, which is more of a tragedy than a study, which took place in the 40s. And it basically, the study involved infecting Black men with syphilis and not telling them. so that they could just follow and watch the physical effects. And, I'm happy to report that I know very much about syphilis and how to treat it and what the different phases look like, but that was born on the suffering of Black men. So it's no wonder why there is a mistrust of the medical community. But it's actually transgender people and people of color who are also the most vulnerable to COVID-19 because they have the worst outcomes. So we need to do a good job of engaging them and protecting them. So I'm here to ask them in particular to seek out vaccination.
Thank you. And Diana, you have worked with these communities that Dr. Chu mentioned. What has been your experience reaching out to vulnerable communities to bring the vaccine to the communities? What has been your experience? What have you heard from our communities?
Thank you, Manny, for that question. So with COVID-19, the information has been rapidly becoming available as experts learn it more every day. We recognize that this information was either not reaching our PI and trans community and gender diverse community, or they were not geared towards that. That was one of the major things that we rectified and noticed when we are talking with our folks. So our PI community is disproportionately already affected by COVID-19, and we wanted to ensure that they are receiving accurate and up-to-date information. Through this, one of our online programs such as Friday Facts, Mask and Makeup Campaign, Carry Talks, Ask a Doctor, were born, and we are trying every day actually to reach out to communities and inform them. I think misinformation or disinformation is one of the biggest obstacle that we are fighting these days, and we are overcoming it. We're trying to build back trust in our communities, and we are seeing positive outcome out of that. Thank you.
Thank you. Pasha and Yen, I know that the DOH has tried to integrate the LGBTQ community and voices and other vulnerable communities into the development of the strategies and the distribution and how to create the phases. Can either one of you speak to how that process went about? How did the DOH reach out to our communities to get some input on those processes?
Yeah, thanks for that question, Manny. So we talked to about 568 different people, including doing about 90 different focus groups and surveyed about 18,000 people in our outreach efforts over the fall. And respondents were able to self-identify. So we do know that, we obviously had members of the LGBTQ community surveyed. However, because of confidentiality, we obviously can't say who those people were or what organizations they represent. But we're basically prioritizing off of, not off of specific identities, but rather conditions that folks have that might lead to higher risk of exposure or severe illness with COVID. So yeah, and our data systems are a huge problem. It's a flaw. We know it's hard for us to get the information that we need when we're not to determine how COVID is impacting our communities or not when we're not getting that information. So we really, that's a focus area for us is naming that, that we're not collecting that data right now. So we don't really know exactly what the impact of COVID has been on the LGBTQ community in particular, as we have for certain race and ethnicity groups. But the LGBTQ community has definitely been a priority for us and will continue to be a priority for us.
Thank you. And I understand that the DOH and the Department of Health does partner with other community organizations and community groups. We hear, Utopia Washington, for instance, and Diana's experience, different clinics. Can you tell us a little bit about some of the partners that the DOH is working with throughout the state to make sure that our community, specifically, the LGBTQ community, has access to the vaccine?
Yeah, another great question. So I'm going to drop a link in the chat. We've worked with a lot of different community partners, CBOs, There's an exhaustive list that I'll pop here in the chat so you can see, but we were working with people from disproportionately impacted communities. So the Black African American community, Latinx community, immigrant and refugee communities. We've reached out to essential sectors and services like the agricultural sectors, farmers and migrant workers, seafood industry. We're also working with like our local health jurisdictions and our healthcare systems and other high priority groups. So like youth and foster care, faith-based communities, and the LGBTQ community is in there as well. So I'll pop the link in the chat because there's a lot of different groups and people that we've engaged. Way too much to read in the time that we have here.
Yeah, and to, can folks hear me?
Yes.
Hi. Yeah, just to add one more piece, specifically, you know, Utopia was one of the orgs that have been funded through DOH in our efforts to offer better COVID-19 outreach and engagement. Also Entre Hermanos, Gay City, Gender Justice League, Traction, Trans Community Action, and Heart Spark Press. So we're getting, as an agency, we're getting closer to really reaching CBOs that are more relevant in our LGBT communities.
Thank you. And I want to remind our community that if you are part of an agency that provides some sort of healthcare service through your agency of any kind, and your agency serves the LGBTQ community, feel free to reach out to us at the commission and we can put you in touch with the DOH and their outreach programs. If you are looking to be engaged in these programs of distribution, you can check in with us. We can put you in touch with the appropriate people at the DOH and making sure that our communities have access to the vaccine. So just a note out there for the whole community. I want to go back to Diana and ask you, Diana, what are some of the concrete concerns that you have heard from the community related to COVID vaccine? What are some of the fears that you have heard? The things that people are thinking, oh, I'm not gonna get a vaccine because I'm concerned about these.
So thank you for that question, Manny. So there was some, initially when prior to the vaccine, we were listening to, in December when we were having engagement with our community at large about the vaccination and during test sites, we were hearing from community members that, they felt that the process was very rushed and they were not confident enough if there were any things missed out during the whole process of developing a vaccine. As information and things came out, we had been able to debunk that misinformation and also bring out confidence with our communities. The other thing that that was very crucial that we found was that there was actually a kind of a misinformation also floating from the other end, which was that PI folks or people of color, BIPOC people didn't want to get vaccinated. Mm-hmm. When we opened up, we have had some vaccination sites that we opened up with some stakeholders like Swedish and City of Seattle. Our vaccination slots got filled in like within 24 hours. So this is just a wrong information floating around that BIPOC people don't want to get vaccinated. It's not true. They are waiting to get vaccinated. It's just that we didn't have access. Our people did not have access to technology. Every time they were going into this mass vaccination sites or these vaccination sites that were, targeting our elders and people in our community, our elders did not have that access, infrastructure access to those vaccination sites. It's not true that BIPOC people did not want to get vaccinated. That is the misinformation floating on this side, and I think it's a little bit exaggerated too. So we need to combat that, and we need to be factual and say yes. There is some segment of our community that is still not sure, but it's not a big number. That that it's very negligible, and they're coming around. They're seeing, of course they have fears, and we are trying to help them really, make the decision for themselves. But it's not true that they did not want to get vaccinated in the first place.
Thank you for addressing that, because I think that, yes, there is this perception, right, that our communities, especially minoritized communities and ethnic communities, fear. And Dr. Chu spoke to this earlier. There is the history of discrimination within the medical field. And at the same time, with more information and more partners that are willing to work with our communities, more information is coming out, more understanding of these processes, and the medical, field is available. So yeah, our communities are accessing some information and making sure that those concerns are being addressed. So there are two things here that Diana shared that I would like for us to dig in a little bit more. One is from the medical scientific position, and the other one is for the community distribution and all that. So let's start with that one. Pasha and Yen, one of the things is, the concern of accessing the vaccine, going through the process, having to navigate this. So what are some key things that we have to keep in mind from the DOH, phases, and how to access, what tools exist out there that available to our people, to our communities, to access information on the vaccine, sites, locations, that sort of things. Can you speak to that?
Yeah, sorry. I'm like, can I unmute myself? Yes, I can unmute myself. So yeah, we have a number of different sites and tools on our DOH webpage. So we can definitely share that link in the chat. So we have the phase finder to tell you if you're eligible. And we have the vaccine locator tool as well, so you can find where the nearest vaccines are available. But I really want to stress that vaccine planning does happen at a local level. And so we've been doing our best to figure out what local health jurisdictions need to be able to get vaccine into people's arms, right? And so through that, we've developed some pro-equity strategies that allow us to comprehensively and holistically address the gaps and needs of vulnerable communities. And so I will drop that link in the chat. Sorry, someone is, do you hear that?
Someone is having fun.
Yes. So yeah, I'll drop that link in the chat. But one of the areas that we are really focused on is like funding and investing in community rooted and community led organizations that are already doing this work, like Utopia. And so I'll go ahead and pop that link in the chat. But yeah, I think for us, it's really supporting the local efforts and really trying to encourage our providers to adopt these pro-equity strategies that we think really do address the gaps in equity that we're seeing.
There was one concern that came to us at the commission, and it was the perception that someone had about, I qualify for the vaccine, but I haven't been able to access it. And my understanding is, and I want you to clarify this, my understanding is that there are many factors that make you qualify for the phase in which we are right now, which I can't remember which one it is, but it's like the third one or something like that, 1C. But what I wanted to address is, there are different factors that play into consideration when assessing whether or not you qualify. So if you think that you qualify, you need to take the test. You need to take to answer the questions to find out if the combination of things make you, qualify for a vaccine. Is that true? or how does it work? Yeah, and
So
I see
there's
you.
a couple. Yeah, can you hear me?
Yes.
Yeah. Awesome. Yeah, so there's two answers to this, and they actually also roll into our more like holistic, comprehensive pro-equity vaccine strategies. But specifically to answer the question about how to find an appointment, we did just release a tool last week called Vaccine Locator, where you can log on, and I can put it in the chat. You can log on, and after you go through Face Finder, you can find out where there are vaccines available in the state. Back a little bit also to our data systems and the ways that folks are able to access those systems. It's not always the most streamlined, but it is really we're really addressing this vaccine provider situation. And with vaccine providers, there's currently we are in phase 1B tier 2, as a matter of fact. Yeah, just last week, our eligibility increased to 740,000 people in the state of Washington. And it's due to prioritization of some high-risk critical workers in certain congregate settings like agriculture, fishing, vessel crews, food processing, grocery stores, those types of places. Also, people who are 16 years or older and who are pregnant or have a disability that puts them at a higher risk for severe COVID illness. So that prioritization just went into effect last Wednesday, and we also expect that the group of people eligible will be increasing quite quickly, week to week, especially given the mandate for having everyone eligible by May 1st. We continue to also rely on supply and allocation as part of the process for people to be able to find these accessible or available vaccines. But we really are doing, through minimum requirements and through a lot of education and outreach, reaching out to all 4,000 vaccine providers with our pro-equity strategies so that they will also be prioritizing folks based on that intersectional lens.
So the reason why we have prioritization of certain health issues and whatnot is because the supply of vaccines is limited. So we need to put in place some sort of process to reach out to those that are most vulnerable. And that's one of the reasons, right? That's how I am understanding this. I just want to hear from you what you think about this. But because the supply is limited, we as a state need to make sure that those who are most vulnerable have access to the vaccine first, and then go on and go on. And hopefully more vaccines will be developed soon, especially with some actions by President Biden in encouraging more organizations to put things in place and developing more doses. So that's something that we need to keep in mind as well. There was another concern that Diana shared that was from the scientific and the medical perspective, and is this safe? Because it was developed rather quickly, is it safe for me to access the vaccine? So I would like to hear from Dr. Chu and from David, Dr. Hirschberg. Is it safe to get the vaccine? And then how each one of the vaccines that is available right now, we have 3 right now, Pfizer, Moderna, and Janssen, developed by Johnson & Johnson. So is it safe to get the vaccines, and how do each one of the vaccines work, if there's any difference? So Dr. Chu, you want to start?
Sure, yeah, to start. I'm sure David's gonna add more detail, but they're all safe. They're safe. They're very safe. We hear a lot about the instances where someone has a severe allergic reaction, but that the rate is that something like 1 in or 11 per million doses given out. So this is exceedingly low, and it's well outweighed by the benefit. I can speak, so, and David again can speak more expertly on this, on how the vaccines work, but ultimately they all work by causing your immune system to create antibodies against the pathogens, invading pathogens. And an antibody it's a protein that attaches itself to the pathogen, and they glom onto them, and they cover them, they neutralize them, and they allow other elements of the immune system to destroy them and sweep them away and get them out of us. So it's all about these antibodies. And I guess traditional vaccines, David's going to kill me, they work by basically pulverizing the viruses down to like bits and pieces, essentially, and you inject bits and pieces to show your immune system, hey, look at these things that could enter the body and create antibodies against these. And I've oversimplified that, but really that's ultimately how they work. But the 3 current vaccines that got the go-ahead from the FDA can be understood with the analogy of thinking of it as like antibody printers. These certain cells are like antibody printers, and or protein printers. And the Moderna and the Pfizer vaccines are just injecting you with the software that causes that sort of these printers read and pump out these proteins. And specifically, these mRNA ones are asking these printers to print out these spike proteins, which are why we call it the coronavirus. It's named after this crown of spikes on the outside. After a short while, that mRNA breaks down; it goes away. So it doesn't stick around, doesn't ever enter the mainframe. It doesn't enter your cell's nucleus, so it doesn't alter you at all. So it's very, people have that concern as well. Does it alter my DNA? No, it just causes your cells to pump out this piece of the spike protein. And so now your immune system sees all these spike protein pieces and makes antibodies. It's just a more elegant way of getting those bits and pieces into your body. And the Johnson & Johnson one works by just taking an absolute 100% harmless virus, 100%, and using that virus to deliver a different kind of software to the printer cells in the body. And then, of course, the AstraZeneca one is also quite similar to the Johnson & Johnson one. That's my understanding.
David?
Good. I think that was pretty close. I mean, I basically am totally agree with Dr. Chu that these vaccines are incredibly safe. I mean, even some of the old style vaccines that you're injecting peptides into that are made in factories. This is a new class. So you're really looking at sugars. DNA and RNA are essentially a sugar that are injected into your body. And yeah, your cells now become the factory to make those proteins and present them to the antigen presenting cells. And so the antibody response is important. Obviously, it engages T cell response. And I mean, I can't stress enough how safe and effective vaccines are to everybody. And so this is really, it's a game changer. And even for those of us that may not, you're looking at effectivity rates of 95% for some of the RNA ones and 72%. This is not, it's okay if you get a 72% antibody. It basically means that is getting above a bar, which is going to break a lot of the infectivity of the virus. So, think of it more like a driver's test. As long as you pass, you can get out there and drive. It doesn't matter whether you got a 96 or 72. And from the standpoint of the safety, it's really incredible. This is why it's so important to vaccinate so many people around us, because those of us, even when you say something like 95%, if you flip that around, it means 1 out of 20 people that are vaccinated are not fully protected. And so that is really why we're looking at this kind of ability to vaccinate as many people. It really does matter if you get a chance at any of these vaccines. And this will change very quickly in the next month or so. It's going to be available for everybody, but it's going to be very important for all of us to do our part to get vaccinated and really build up this herd immunity that we've been talking about, so we can break these cycles of infectivity.
Can you speak more about that herd immunity? We hear that all the time. What does it mean? How do we achieve that? Do we just jump into virus and everybody gets sick? What can you say about that?
No, and I want to distinguish this from herd mentality, which is really a bad thing. You want to have herd immunity, not herd mentality. No, but really, what we're talking about is circulating antibody reaching a certain level or T cell activity so that you have some protection and everybody in the population has some level of protection. And really, in order to get to that, because all of us are protected at different levels depending on our immune system and our age, you really want to have people around you to have some ability to respond. And really, when you think of the immune system, it's like a ticking clock. When you're exposed to a virus, even if you have antibody, your body now is responding to that the way, and so what vaccination does is gives you an edge. We've adapted already. And so your body responds much faster in a matter of days to an invading virus. And so that's why it's important, no matter what state of immunity we have, you want to not be exposed to a lot of virus. And that's really what's happening now. We're surrounded by people that have virus. And so the average person is, when you become infected, you may be infected by many different events. And that's really the importance, is you're starting with a high load of virus. And if you have very little protection, you may not have enough time to fight that off. And so that's really what we're talking about, herd immunity. You get the circulating virus in the environment down to a much lower level. And then everybody has, or at least most of us have, enough immunity so that the virus doesn't catch fire, doesn't have enough fuel to jump from person to person to person the way it's been doing.
Thank you. So herd immunity, not herd mentality. So Dr. Chu, you mentioned, excuse me, allergic reactions, and a lot of people sometimes get confused between an allergic reaction to the vaccine and side effects of the vaccine. I can share my own experience. I got the Johnson & Johnson developed vaccine, and I did get all of the side effects. And as I was talking with my mom, like telling her my experience, because she got the Pfizer vaccine back home in Puerto Rico. And I was telling her, I know that it's not an allergic reaction, it's just the side effects, but they're brutal. For me, they were, and it's going to be different for every person. But can you tell us a little bit about the difference between an allergic reaction to a vaccine and the side effects and how to manage?
Absolutely. I get this question a lot from my patients. Am I on off mute, Coach? So I'll start with just the understanding that the process of the immune system waking up and creating these antibodies we've been talking about, it happens all over our body, and you can sometimes actually feel it. It's actually a lot of what you feel when you get sick from a cold or flu. The fever, the chills, the fatigue, that's not the virus, that's you. That's your immune system fighting it. So when we use the vaccine to turn on the immune system, it can feel very similar to getting sick. We call it vaccine response. I don't like to call it side effect, like vaccine response. But yeah, it's what can happen as part of the process. You can get these generalized response symptoms like fever, chills, body aches, fatigue, headache, nausea, and at the site where you get it, you can get some soreness, some localized pain. In pretty rare cases, there's an overlying rash. They call it COVID arm. It's just it's this round, weird rash on top of the area you got it. And speaking from personal experience as well, I got the Moderna vaccine. The first one was fine. I had a little bit of soreness in my shoulder, and also with the second one. But the second one, I did get a little bit of fever and chills, but happily, just because I knew my body was churning out antibodies and I wanted all the antibodies. So I was kind of happy about it, actually. But I want to point out as well that you don't always feel the vaccine response, but it doesn't mean it's not working. You just have the vast majority of people who get these vaccines, you're gonna feel just fine, maybe a little soreness, but they've got nothing going on. But so there's vaccine response, and then there's actually true allergic reaction, which true allergic reaction tend to be pretty severe. When we distinguish between like these vaccine response and side effects, and then like severe allergic reactions, also known as anaphylaxis. And these can vary widely, but these are things that you kind of, your basic human instinct is that something is wrong here. I always listen to my patients say something's not right, something's wrong. And you can have a variety of things going on. You can have shortness of breath, you can have chest pain, you can have a sensation of throat closing, you can have nausea, vomiting, diarrhea, abdominal pain. I mean, these are not things you normally expect it when you get a vaccination. And this is pretty it usually happens pretty quickly, but you're going to drop, it can drop your blood pressure, you can have dizziness, fainting because of that. You can get, you break out in a huge rash, itching, swelling of the face and throat. So this all feels, it seems it's outsized to what usually happens with the vaccines. And I wanted to point out as well that all COVID vaccine providers who sign up to receive the vaccine and deliver it, we have to be able to handle severe anaphylaxis. That's part of the agreement. So what we all do is we're going to be watching patients from 15 to 30 minutes, depending on if they've had a severe reaction before they're allowed to leave. And then we also have to have 3 doses of epinephrine on hand at all times. So it's so rare that this is going to happen, but we are prepared if it happens. And so I don't want anyone to focus too much on these anaphylactic reactions because they are so rare.
Thank you. So just to summarize and to make clear that people understood, an allergic reaction, it might be more sudden, it might be more it will be more severe. It's something that is completely strange to you. You're gonna feel very different than a normal reaction to your body developing the tools to combat the virus, which is a normal reaction, and it might develop a little bit later as your body continues developing those defenses.
Yeah, I'm going to point out real quick as well that the reason why we watch for 15 minutes is because when the CDC did look at the rare anaphylactic reactions, the vast majority of them occurred within 15 minutes when you are there with people watching for this. There are some cases of reactions that have happened, after they got home, but again, they're quite severe, and they would cause you to wonder. And when in doubt, you always want to seek a medical evaluation. But these are exceedingly rare.
Thank you.
I can just add a
ahead.
couple things on just with the symptoms we feel after vaccine, which, I don't want to discount. They are, we do feel them. We all, I had fevers and chills also. But if you look at studies out of Israel, which did a really good job of vaccinating their population, a large amount of their population quickly, and then turned over the data to the world so we can take a look at it. Almost everybody who had the first vaccine, none of them ended up in the hospital with severe COVID symptoms or in an ICU. And certainly those are much more severe consequences, than what we're feeling with the fever and chills and a couple days of our immune system kicking in.
Thank you. We are almost on time, but I wanted to check, Omar, do we have any questions from our social media channels that people have presented? Or
I'm looking at chat right now, and it doesn't look like we have anything on the YouTube channel. And let me just double check. And nothing in the Facebook group as well.
Okay, well, thank you. I do hope that people are watching because this is important information. And we have wonderful panelists. So yes, or maybe it's because we have answered all the questions, right? And they're ready to get vaccinated. So with that, actually, Diana, do you want to tell us a little bit about, what can we do as LGBTQ individuals and Washingtonians to advocate for ourselves to get access to the vaccine? How can we be our own advocates to make sure that our community is safe and has access to this important vaccine?
Thank you for the question, Manny. I think, as a trans woman, living and navigating life through in this world at different stages, there have been a lot of opportunities that have been taken away from our community. This is, I think, is a great opportunity where this is perhaps one of the first time, or maybe one of those times where there's been so much inclusivity, so much discussions, and so much we have been part of and part of the leadership of accessing and planning of how the vaccine, or how the rollout is going to be, and how the government has also included us in dialogues and thought that we also have some role to play. I think that gives us a not just a moral duty, but also as member of communities, a responsibility to ensure that not only we are protected, but also our folks, that our families that we take care of, our parents, because if you look at LGBTQ community, especially from Pacific Islands, we are all attached to our families. We look after our parents, we look after our siblings and our nephews and nieces. Most of our parents may be grandparents now. To protect them, I think it's just really, really important to get vaccinated. And of course, with so much information and so much data now available, and that we have access to, and to decide for ourselves, to choose to make the right choices for ourselves. I wanted to just also add something. I love the way Dr. V explained about how the vaccination works and how when it enters into our system. I heard him say that, think of it as a software being injected into your body. I think that is a really, really great and simple way of understanding it. But at the same time, there has been a lot of misinformation around this kind of, thing. I remember last year, I was asked by a group of young people. They asked me, when the vaccine is going to come out, there have been reports that they are going to inject a chip into our body. So I want to make very clear that Dr. V was actually giving an example. There is no chip, no software that's in that vaccine that's going to be going into our body and our system. Please do not misunderstand. For the past 6 months or so, we have been working a lot around this misinformation and disinformation. We create programs like Friday Facts, and where we provide scientific-based information to our community members, which is around COVID-19, that's extracted from CDC, Department of Health, and Johns Hopkins University, and then other reliable sources. So yes, please, I request all of us to take that step of leadership, take that step of responsibility, and get vaccinated if you have if it's your chance and you get the opportunity to. Please don't let it go. Let's get back to normal.
Thank you.
Thank you.
And still, wash your hands, cover your mouth and nose, even if you have been vaccinated. That's very important, because we cannot, lower our defenses because people around us are still vulnerable. So make sure that even if you got vaccinated, make sure to take those precautions. So just the last words from the rest of the panelists. I'm going to go around. Any final words for our community, Dr. Chu?
I just really want to bring it home that these vaccines are so safe, they're so effective, and it's really within ourselves to be able to return to normalcy safely. If we can acknowledge the unique challenges of our community, if we can take action to reduce disparity, and just get everyone vaccinated as quickly as possible.
Thank you.
Please do.
David, any final words?
Yeah, I think I would echo that, and then just what you mentioned about really wearing a mask, keeping social distancing. This is going to be critical until people are vaccinated. We are racing against time. Even though I think really only 16% of the population here in the United States has been double vaccinated, we need to get to 60, 70%, and then we need this all over the world, not just here in the United States. And right now, the vaccination programs have been unequal. There's definitely people that need to be vaccinated. And if anything, the virus is really showing us a lot of the disparities in the way we spread medical coverage among people and economic coverage. And so, there is a really critical time point here until we all get vaccinated, that we really have to be vigilant in controlling the spread of the virus as much as possible. And so we just have to, we're so close. We just need to be vigilant for another month or two until we can get more and more people vaccinated. And so still be careful.
Thank you. Yen, any final words?
Yeah, I think that the pandemic has put us all in a position to really find and correct or ameliorate equity gaps in order to advance as a state and to get ourselves care for ourselves and each other. And I think in that sense, going back to normal is actually not the end goal. Like, we are actually going to a place where more of us are going to be keeping these things in mind. And as this pandemic or becomes endemic and we continue to address these gaps in equity throughout our state in terms of how we as LGBTQ folk access healthcare, we will find that a lot of the efforts we put in now to learn, communicate, share with each other, each one teach one kind of efforts, that these will build over time, and that all of these pro-equity strategies will actually create even in a few months, as supplies increase, will create a better version of what we were working with before. And so with that, I'm glad to be part of this. My colleague Pasha is unable to join back with us, unfortunately, but we're both excited to be part of this, and please feel free. I'm happy to put in my email address in the chat if that's amenable. And please feel free, anybody who's watching, to reach out to me or to my team as we move forward with our strategies. Thanks.
Thank you. Final words, Diana?
Yes, thank you. So any of the folks that are watching and listening to this panel and this discussion, if you are finding it accessibility to vaccination is difficult, please contact us at Utopia Washington, Diana at utopiawa.org, or you can reach me on 206-653-1944, and I will help you set up a vaccination appointment. And if you're eligible, of course, I will help you set up a vaccination appointment. We are working with some different partners, and we have some vaccination sites open. So please don't hesitate. If you're eligible, you fall into the vaccine category, eligibility now, please contact me and I would be happy to help you. Thank you very much.
Thank you. Thank you so much to all our panelists. Thank you so much, Diana and Utopia Washington. You're doing an excellent, wonderful job. And I love Utopia and the team there. You're doing excellent work. Thank you so much, Dr. Chu and your team at Capital Medical. You are really pioneers in serving our community, and we're so happy that the clinic exists, and hopefully more similar clinics will pop up throughout Washington. We're working on that. So thank you so much. David, thank you so much for accepting our invitation to be here tonight. Thank you for the work that you do with research and with the youth that you encourage there at RAIN to explore their passion in the science and technology. You're doing an amazing job, and thank you so much. And Yen and Pasha, thank you so much for bringing our voice as BIPOC queer folk to the work of DOH and the Department of Health and the COVID response. Really, it's been an honor working with you. And for the community, if you didn't know this, the commission had given feedback to the Department of Health in the different parts of developing, the phases and developing of the strategies to reach out to our community. So our voice has been there, and certainly Yen and Pasha, as well as Paj, who has worked with you, they have been amazing in keeping our voices there. To the team at the commission, Brandon, Brandon, Katie, Omar, thank you so much for all your work here with our technology and behind the scenes. It's always good to work together as a team. And we say goodbye to Brandon, who ends his internship with us next week, but he's been amazing as a part of the team. So, and we'll welcome another intern that you all know next week. She starts with us next week as well. So to the community, please, once that you know that there's a availability of the vaccine for you and you qualify according to the phases, you know, make your appointment. Let's make sure that we do have herd immunity, and you know, let's keep our community safe. We're gonna keep this recording of the panel available in a couple of weeks as we add closed captioning, so it makes it more available to other people who could not be with us as well. And if you have any questions, please, our emails are there for Omar and I. Feel free to reach out to us with any questions, any concerns. We will be happy to address those or connect you with the organization or the department that will be able to offer you those responses that you're seeking. So community, thank you so much. Thank you for always being there. And let's queer Washington up, because that's our job. And to the panelists again, thank you and good night.